Morning. Happy Friday. We're glad to have you here. We have a great crowd today. A lot of people have joined us. We do have a slight change with the original Evite. Our director, Liz Matney, could not be with us today, but we are excited to have the assistant director, Julie Lovelady, be with us today. And so we'll get started with her in just a little bit. But we also have some exciting news. We have a brand new public policy person with us, and she's here today, even though she hasn't started with the DD Council, but we did want to introduce her and have her share a little bit about herself. She will begin with us on December 12th, and her name is Carlin Crow. And so, Carlin, I'll go ahead and have you say a few words about yourself and introduce yourself.
Thank you, Brooke. And I'm really excited to start working for the DD Council here in a week or so. I'm working right now for another week with the Spina Bifida Association of Iowa. And through my work there, have been actually partnering with the DD Council on our advocacy efforts. So I've had the privilege to be on quite a few of these calls, and I know some of you from these calls, and I know some of you from other areas of my life too. But I really look forward to meeting all of you and learning about what's important to you in your work for people with developmental disabilities, and how we can all work together to make lives better in Iowa for people with developmental disabilities. So it's a privilege to be part of this council and start doing this work, and just really excited. And I will probably be reaching out to many of you individually, because I want to get to know you better, and just hope our new year is very successful in the public policy arena. So thank you all for the opportunity.
Thanks, Carlin. And I couldn't, well, Amy maybe too. We can't be more excited for you to get started with us. So we've already had a meeting earlier today, and we have a bunch of stuff already on the list for you. So the sooner the better you can join us. That'll be great. Now, I do want to introduce Julie. I think we should talk a little bit about what we were going to have Julie talk about. I know everybody, or most of you may have saw the news that the Department of Justice settlement about Glenwood came out yesterday. That actually is not the topic that we have Julie talking about today. Instead, she's going to visit with us a little bit about the evaluation process that the Medicaid department has been going through, and some of the suggestions and recommendations that they're going to be doing, hopefully doing, to help improve the home and community-based services for folks, which kind of also would go into a little bit of the recommendations that they're getting from the Department of Justice. But we will be spending more time talking about the Department of Justice settlement through Infonet. So we will have information coming forward on that, and I'll go ahead and put the link into the chat. So if you have not seen the press release that came out, you can take a look at that and know that more information will be coming. But Julie, when I thank you again for joining us today. We appreciate having you. It's good to see you. I don't get to see you as often as I used to. But I'll leave it up to you. If you want to mention anything about the settlement, the floor is yours. So if you want to talk about that, that's okay too. But know that that's not the reason that we asked Julie to join us here today. So Julie, go ahead.
Sure, it is, and it's great to see you as well, Brooke. I do miss networking with you more frequently, so it's nice to see you. And good morning to everyone. I believe this is the first time I've attended one of these council meetings, so it's nice to be here. Director Matney, she had a conflict, as Brooke mentioned, but she did give me a few talking points of things that she wanted to share with all of you today. So the first one is just, I'll touch very briefly on the Department of Justice consent decree for the first phase of the investigation, which is really specific to Glenwood. It was finalized and filed yesterday, as Brooke noted. It can be found on the Glenwood resource page, Department of Justice Resource Center Investigation, Iowa Department of Human Services. And just a couple of things to note, there were some reoccurring themes throughout the agreement, and they are as follows. Work towards substantial compliance with nearly 300 separate provisions, so lots of things in there. Establish processes to ensure all services and care provided at the Glenwood Resource Center is consistent with current, generally accepted standards of care. When care and services don't meet generally accepted standards, deficiencies are addressed by appropriate staff. Regularly monitor the effectiveness of all treatments, supports, and interventions, and take steps to modify them in response to clinical directors or clinical indicators, Use valid, reliable, and sufficient data to inform decision-making. Maintain detailed records of assessment, treatment, and diagnoses, including reasons justifying decisions not to treat or diagnose, and that they are accurately and timely documented in the residents' records. So just a couple of stats to share with you too. As of November 28th, the following transitions have occurred. 11 residents have transitioned to Woodward Resource Center. 16 residents have transitioned to home and community-based supported community living waiver homes. 3 have transitioned to host home residential programs, providing residents with a stable home environment to live with former GRC staff. And 2 have transitioned to home and community-based HAB services homes. So we'll also have a transition. We also have transition information on our public dashboard. So if you're all familiar with that dashboard, that information is available, although the information lags a little bit in the reporting. So those are just a couple of things that I wanted to point out on that. And as Brooke noted, there'll be more discussions on that later as well. Second topic I wanted to talk a little bit about is the community-based service evaluation. And that final report is due in January of 2023, which is, it doesn't seem possible that it's January next month already. I'm still kind of not believing it's December yet. So we'll need some extensive community stakeholder engagement to implement recommendations in a successful manner. So we plan to keep you all informed of these opportunities because we are going to need a lot of stakeholder feedback. Some of the summaries of the findings from this community-based service evaluation, I was processed, and I don't think some of this was probably new to some of you, but these are some of the findings, summaries that we have. I was processed for managing waiver waiting lists, does not support timely, efficient, or needs-based access to appropriate services. Iowa's current Medicaid HCBS waivers are diagnosis-based, which limits equitable access to HCBS that align with the needs of Iowans. Iowans have a hard time learning about and accessing CBS supports, both Medicaid and non-Medicaid. Iowa's CBS system does not coordinate across public funding streams, including its mental health and disability services, regions, and Medicaid to efficiently allocate resources. And Iowa should better support the connections and transitions between different components of the long care system in Iowa. So we'll be working with legislators on appropriation needs to fulfill these recommendations over the next few years. A little bit on community-based case management. Right now, we're holding a focus group with a small group of case managers from each MCL, and we'll be working to identify gaps and opportunities around the following areas. Policy and communication, existing processes and opportunities for improvement, training and resources, CBCM support, and then Medicaid will bring the findings and next steps back to our town halls for additional feedback. Most of you are familiar with our town halls, and I think we get a lot of good feedback from our town hall meetings, both from the provider's perspective and from our members' perspectives. And those were the updates, Brooke, that I wanted to share today. So I'll turn it back to you.
Julie, do you have time for some questions if we have some?
Sure.
Looks like Roxanne had a question. Are there any consumers on the pilot group with the small group of case managers?
I will check to see that. I don't know for certainty. So consumers, okay, let me check on that.
Does anybody else have any questions for Julie before we go on?
I'm a slow typer. This is Kate. So I'll just ask my questions. Julie, do you know if DHS and or Medicaid has included budget requests to the governor's office to help implement the recommendations that would be coming out of that common community-based evaluation?
So I think the question was, has there been conversations with the governor's office? Is that what you asked?
Well, conversations about including in the budget that she sends to the legislature. I mean, I know the legislature can, do their own budget, but the governor usually send over a budget that has different department budgets in it?
Yes.
And so I'm just wondering, do you know yet if the governor's office is including in their budget to be sent to the legislature funds to implement or to be at least begin implementing those recommendations?
I believe that there have been conversations, but I will send a follow-up just to provide a little bit more clarity on that.
Okay, thanks.
Looks like Brady, you have a question?
Yes. So I was just kind of curious, as a client, I used to live at the resource center at Glenwood, and I guess my question is and concern is, I know a lot of those clients that are having to be moved out of Glenwood, and how is the resource center and the state working with individuals that are going to be moving to determine where exactly they need to move? Because there's some clients that are an appropriate fit to move to Woodward, and there's some clients that are appropriate fit to maybe move into a nursing home setting or into the community into HCBS. But how are they determining for each client's needs on where the appropriate place for them to go is? Because, and the reason that I'm asking is I know some clients, and I still talk to them even though I moved out of the resource center, but there's a concern because they don't know if they're going to go to Woodward. They don't know where they're going to go, and it might be that they go in the community. My concern is with some of these clients at the resource center, there's just some clients that just aren't ready for the community. They're not safe to live in the community. They might be having some mental health problems that gives them anger problems or lashing on people. They're just not safe to live in the community. So my question is, how are we as a state working with those individuals to make sure that they have the right kind of services and the right kind of settings so they can live a successful life wherever they live?
Yeah, that is a really great question, Brady. And there has been a team of individuals that are working with all of these individuals, first to determine what are the needs of the specific individual and where can they best be suited in an environment that's the least restrictive, the environment that they feel comfortable living in. So it's a very good point, and one that I know that they have taken, great strides in trying to, have teams of members, that includes the MCOs, that includes Medicaid, that includes lots of individuals in trying to determine what are the needs of specific individuals and where can we best serve them in the community.
Right. I mean, because I've been in and out of facilities so much throughout my life, and I've seen clients get put in the wrong kind of setup, and then they end up getting either in legal trouble or they get in trouble with the law. And then another question we have to ask if that happens, are they consider it more of like a mental health issue, or are they going to charge them for a criminal act? And that's what I'm worried about with some of these clients. If they were to move into the community, they're not ready, something like that's going to happen, and then it just goes downhill from there. So I wanted to make sure that advocacy for these clients is a top priority, because we want to make them as successful as possible in the community.
Yeah, and I think all that planning on the front end, as well as even monitoring on the back end, once people are transitioned, monitoring to ensure that things are working well for them in their new setting as well, is going to be critically important.
Yeah, I agree. Thank you so much.
Thank you.
Julie, I'm not seeing any other questions or any other hands raised. I'll ask one more time.
I do have another question.
Oh, sorry, Kay, is that you?
Yeah, I was starting to put my hand up, but I'm so slow on stuff. No, I'm just wondering, I was reading the article about the settlement agreement in the register, and Brady's question reminded me of this. It says in there's one paragraph that talks about the consent decree states residents should not be transferred to Woodward unless they have been provided a meaningful choice. This is a quote, a meaningful choice of community providers consistent with their identified needs and preferences. And it goes on. I'm just wondering, Julie, can you define, well, number one, does the Department of Justice define what they mean by meaningful choice? But also the same to the department and Medicaid. What are we talking about when we say a meaningful choice?
Kay, I want to make sure that I don't, respond for what their interpretation of meaningful is, and I will go back to see if there is an interpretation. But in my mind, meaningful is that the individual and their guardians or whoever, their family members, have all been involved, and are looking at what is the right thing, where's the right, environment for an individual to live and to be successful.
Yeah, and I also was just wondering if within the consent decree, did the Department of Justice provide any clarity of what they mean? But maybe
yeah, I'll go back and see. So I think my couple of follow-up items for UK are, what is defined as meaningful choice, and then also about the what conversations have been had with the governor for the budget, and I will follow up on if consumers are involved on the community-based case management group. I think those are my three takeaways. Was there anything I missed from anyone? I want to make sure that, and Brooke, is the best thing for these to kind of go back through you and then you distribute?
That would be just fine, Julie. We did have one other question, is whether or not that group of case managers, is that in a localized area or is that spread out throughout the state? I think it's spread out throughout the state, isn't it?
Yeah, that would have spread out through the state.
And we will, Amy, I don't know what would be the best way to post her answers. Should we do it through an email? We'll probably include these answers in the recording of the Capitol chat. Maybe that would be the best place to do it.
Okay.
We should have a list of people that attended that we could send out the answers to directly.
Sure.
As well.
That's a good idea. Great.
I have to say, Julie, I think you should come on each one of these Capitol chats, because I don't think we've ever had 60 people on. So.
I was thinking that same thing. We're just going to advertise that you're going to come each time, Julie, whether you can or not, and then people will join us.
It was probably Director Maddie that drew the crowd. I'm guessing that was probably it, but I'll take the compliment. Thank you.
Well, I think on behalf of all of us, we really appreciate you, Director Matney, and the team for having those monthly meetings too. Those are incredible opportunities for people. So thank you. Thank you again for that.
Well, we appreciate it as well because the feedback to us from both our members and providers is invaluable. It's the only way we can work together to make things better. So we appreciate it as well.
Thanks, Julie. We appreciate your time today, and you're welcome to stay on for the rest of it. You don't need to get off. You can stay on and listen to our rest of our event today.
Actually, I would love to if I didn't have to go to another meeting. So thank you all. It was great to see everyone. Bye-bye.
And I think we'll move on then. I do
There were a
want
couple
to.
of questions in the chat that weren't addressed. Perhaps we can get those answers as well and have them sent out to everyone.
Sure. I know we only had Julie for a certain amount of time, so sorry if we missed some people's questions. I do see there was a few more that was in the chat after I saw the last one. So thank you. Yeah, we can get those answered. I don't know, Amy, if you want to put the agenda back up, but we do want to recognize, we also had two legislators join us today. And I wanted to recognize Representative Mike Burbett and Representative Chad Engel joined us today. So thank you for joining us. We don't always get legislators that join our Capitol chat. So welcome, and we're glad that you're here to listen to this. So as everybody probably knows, we're close to legislative session. It does start January 9th. So we have it's going to be an exciting year this year, actually, because there's going to be 1 out of 3 of our legislators are brand new. And so this is a great time to educate folks on what some of the issues are that we face in the disability community, and get out there and visit with new folks and make sure that they know who you are and you talk to them about issues that are important to you. The DD Council, right before Thanksgiving, did release our 2023 agenda. We did get it out earlier this year, so we're excited about that. You may know, if you follow us closely, that our agenda, our 3 items, really haven't changed that much from the previous year. There was some work done in all 3 of these areas this last session, but there's still more work to do. And so our council felt strongly about keeping the momentum going and focusing on the 3 main areas that we did last year, and that's to fully fund healthcare services and community-based services to address the workforce crisis in both the rural and urban areas. That's still an issue. We still are in a workforce crisis where folks are struggling to find the right supports that they need to be in the community. We still want to support an inclusive and accessible community for all Iowans. We did add the word accessible because there's still some issues in parks and restrooms and sidewalks that still needs some work to be done. And so we want legislators to invest in an accessible and inclusive community. And then we also want to reduce and eliminate all home and community-based services waiting lists. So not just the ID population, but reduce and eliminate for all of those waiting list services. And I think, Amy, if you want to just pull up where our legislative agenda is. So we have our 3 main areas, and then we have our ask, and then we have a story that goes with it too. And so do take a look at that. And Amy, are you able to pull that up, or?
I'm sorry, can you see it? I pulled it up, but
I'm still seeing the slide.
hold on a minute. Apparently, I will get it back up here.
Okay, and Emily did post it in the agenda, so you can, or in the chat, so you can see it, have the link of it.
Can you see it now?
Yep.
Okay.
So those are our call to action, as you can see, for each one. And then more importantly, well, the call for actions are important, but we also want you to take a look at the stories that we have included in there too. And this is the DD Council's legislative agenda, but if these are things that you feel strongly about that it needs to be worked on, feel free to share this document with your legislators when you do your own advocacy, and share it in your network. It's on our website. And we think it tells a good story about what needs to happen this year when the legislators get back into session. And I think that's all I had on that, Amy. Do I turn it over to you?
I think so. Yeah, so hold on a minute while I pull this back up. Apologies for the rough transitions here. You'd think for in all this time with pandemics that we would actually be whizzes at this now, but I wanted to introduce my business partner. Some of you have met him before. Some of you on this call have not. Craig Patterson, he does a lot of the work at the Capitol with me and is a partner on the InfoNet project. And so I wanted to introduce him, and he has actually known Brady for some time, since I don't know how old he was, young, when Craig used to work on Congressman Nussel's staff. And so met Brady through his parents who are active in that. And so Craig, I'm going to turn it over for you if you want to just talk broadly about election results, and then I will kind of get into the more nitty-gritty stuff in here.
Yeah, and thank you for having us today. Just real briefly, I mean, you've got some information in front of you on the slide. I think one of the biggest things that I'll point out about the election is, I think nationally, before the election, people talked about a red wave, of Republicans kind of sweeping, across multiple states, a lot of elections. I would say after all the votes were counted, there was very much a red wave in Iowa, but nationally there wasn't very much of a red wave. It was actually pretty tamped down, other than maybe Iowa and Florida. So, but here's what we're looking at going into the legislative session is Republicans have picked up 2 seats in the Iowa Senate. So the majority party over there will control 34 of the 50 votes, which means that they have a super majority, which that doesn't come into play very often, other than when the governor nominates somebody for a position. There's usually needs 2/3 of a vote to confirm them. So now with the new supermajority in the Senate, they will not really need to consult with the minority party. So it'll be an interesting environment over there. There's a lot of new legislators in both chambers, as Brooke indicated. In the Senate, we have 14 new senators. Over in the House, the Iowa House picked up 3 Republicans. So they used to have 60 Republicans and 40 Democrats. Now there'll be 63 going into this cycle. So, but just a ton of new legislators. And that's, if I can just underscore that, as advocates, this is your moment. Because of the redistricting that occurred this past cycle, there are a ton of new faces in the Capitol. And I think, we try to remind people all the time, when someone comes into the Capitol, they come in with a certain skill set. If they're a teacher, they know education fairly well, but they might not know, disability services or taxes or local government or other issues. Bankers come in with some financial service backgrounds, but maybe not as much information on other issues. This is really a moment for advocates like yourselves to engage with your new legislators and tell your story, put yourself out there as a resource. So if issues come before the legislature that maybe they're not as familiar with, but you are, they might call you, or email you and say, hey, we have this bill, do you have any thoughts on how I should vote on this? So really it's a really good time to reach out to yourself, to these new legislators, and introduce yourselves. Because you might be able to, affect the agenda that we're trying to advance. So I think that's pretty much the top level, unless anyone has any questions about individual, about specifically any aspects of the election.
Thanks, Craig. I know we will have this PowerPoint on our website, so I encourage you to go to the website. We also have full what we know of committee listings so far, but I listed all of the new representatives because when you do look at it, you can actually see there are some counties that have a really big turnover. Look at how many new Lynn County legislators there are. I just now noticed that I repeated some of them in the Lynn County area accidentally. So apologies there, but there are quite a few new ones there. You've got a couple in Woodbury County, a bunch in Polk County. So you can kind of see that there are some areas where if you live in those counties, you have a really big opportunity to get to know some of these new legislators, you know, right from the first start. Hugh asked in the chat where you can find the contact information. Good question, Hugh. Just last night, I posted a very early draft of our legislative guide. So those of you that have seen that before, we have the bios of each legislator, and those come from either the candidate books that the parties put out or their websites or both. And it gives you a little bit of background about what who the legislator is, as well as their contact information. One thing I would make sure, thank you, Emily. Emily posted it in the chat, the link to that, as did Brooke. One thing I would note is do not email the new legislators at the legislative email. That's the one that ends with legis.iowa.gov, because they haven't been officially assigned that yet. So email them at their personal email or call them on the phone number that is listed. That's usually their cell phone. That's mostly what people give now. That's what I would do, and then wait until you see a notice that the legislative emails have been enacted, because, you know, really until the first day of session, everybody currently holding office is still a legislator. So they don't officially become a legislator until they're sworn in on January 9th. But so I don't want anyone emailing those new emails and getting a bounce back on them.
It looks like Deb Hobbs has a question.
I do. I wondered if you have any of these new representatives or senators have a special interest in disabilities, that they commented during their session, or perhaps they have a loved one that has disabilities. I can also look in the introduction for each of the representatives and senators, if that would be easier.
I can answer that, Amy, if you, this is Carlin.
Yeah.
There's one that I know of, Josh Turek from Potawatomi County, who is an individual with spina bifida and uses a wheelchair. And part of his platform was definitely working to make improvements for disability services in Iowa. So he's very familiar. He was also a gold medal winning Paralympian for basketball, in men's basketball, for like, I think he definitely has 3 gold medals, maybe more. So, and he's very well spoken and very humble and willing to help. He expressed, we had him come talk to our organization. He did a wonderful job talking about many issues related to persons with disabilities. So I think he will be a great person for us to have as a friend and partner in the legislature.
Yeah, we've been following that race pretty closely, and those that have been watching this may notice that he won by 6 votes. So there were 2 legislative races where 6 votes made the decision on those. So a lot of really close races this year. So we're excited to get to know him and work with him. And it's great Carlin already has that relationship with him. But I would say you would be surprised how many people do actually have a connection, either on the mental health side, as Renee mentioned in the chat, that Janice Weiner, who's a new legislator from the Johnson County area, Iowa City area, has a personal interest in it. I think that's one of the most important things to do when you make those connections, is to hear what they say, and if they mention any of those connections. And I would suggest also it would be really helpful if you find out that they do, to let Brooke and Carlin know, so that they can follow up with them as well when they get up to the Capitol. I think that's a really important piece too. I know a couple of them personally do. There's a couple new doctors coming in, physicians. So Megan Srinivas works at Broadlawns, and Dr. Austin Baith Beeth. I can't remember how to, I'm going to mess up his name for a while and question myself on that, but he is also a physician. So there's a lot of people out there that I think that you will find some good connections with from the little bit I know about each one. But when you read about their bios, you can kind of see where their interests lie and the kind of organizations they get involved in. And certainly Googling them or jumping on, making friends with them on their social media is a good opportunity to learn more about what they're posting about and where they're going to be in the community. One thing I have found from this new group is a lot of them are really excited about making connections with people in their district. So I think that's a really good opportunity. They're really excited about starting out. A lot of them are younger. I used to think I was young. Now I know I'm the old guard and that these people are a lot younger and more energetic about getting out. So some of you may even know David Young too, who's used to be the congressman from the central Iowa area too. And I know personally that he was very committed to a lot of these issues too. And I think Brooke, you had pretty good relationship with him when he was in Congress.
Yeah, yes, I did. I was just going to put that in the chat that I would definitely reach out to him because he is very interested in the disability issues. And I think he will want to hear what we've been working on. And we'll reach out to him too as well.
Yeah, so I wanted to show you, we're still getting committee assignments. And I just talked to one of the Democrats, the Democratic staffers today. We don't have any of the Democrat assignments to the committees yet. And so they thought it might be at the latest December 16th before we get those in the Senate, and the House is probably right around the same timeline. So right now we only have a listing of those that are the Republicans on both the House and the Senate. And those are updated in the legislative guide. So you will see the full committee membership. So if you don't, I just posted the ones related to a lot of the issues we're talking about that are on the DD Council's list. But things like the new workforce committee, they've renamed the labor committee workforce. In the Senate, it's labor and workforce, in the House, it's labor and workforce. In the Senate, it's workforce, to more broadly reflect the need to have a focus on workforce of all types. And so I think you can look at all of those committee listings on there. I just pulled up the newly titled Health and Human Services Committee. So those of you that have been around a while know that we used to have a policy committee. So they deal with things not budget related in that. And it used to be called Human Resources, which sounded a lot more like a personnel kind of committee, not really the Health and Human Services. So both the House and the Senate have titled their committees Health and Human Services, which we're going to have to make a distinction when we talk about HHS committee, because that is the name of the budget committee too. So the subcommittee of appropriations, Health and Human Services is also, so we'll probably call it HHS committee and HHS budget subcommittee to make that distinction, just to make it more confusing for everyone. But you can see who's on these committees. Honestly, there's not a lot of change in the HHS committees like you see on some of the other committees. But I've put asterisks next to those that are new to the committee. You can kind of see we have a new vice chair. I did work with Devin Wood a little bit when she was a clerk for Marianne Hanusa, who was from the Council Bluffs area. And I think Brady, you knew Marianne, and with Representative Bodler. So I do know her a little bit. So that's a good, I think she'll be good in that position. But you can kind of see who's on these. One thing to note is they do have a special House Education Reform Committee. It's a small group that's going to be negotiating things like the school choice bill. Some people call it the vouchers bill, depending on who you've heard this discussion from. And it's really just the top 3 leaders of the House Republicans. And I'm assuming that the Democrats will assign their top leaders to it too. So things like big reforms in the education system will go through that smaller group right now. So just wanted to make note of those. I don't know if Diane asked, any idea what the House education reform agenda will be? I do not know, but I believe the starting point is the governor's school choice initiative. I don't know what she's going to propose this year, but she was very active in some of the primaries for people who opposed and won those. I mean, she won with her people that supported her agenda. So I think you will see that being top on that list. I don't know what else might be on that, but I would guess that's a big enough package to devote a whole committee to.
Kay has a question too, Amy.
I'm sorry, I can't see anybody. So.
Kay does.
Okay.
Yeah, see. Kay, did you want to ask your question?
Can you hear me now? Okay.
Yes.
So I'm just wondering if the council has, with the school choice agenda last year, and certainly it's going to come up this year, but has the council ever looked at in some specific things, if it's even available, of the impact that will have, particularly on students with disabilities? Because I've always been saying that, those are the students that are going to be left behind, because typically, whether it's charter schools or private schools, they, with the thing that was last year, they would have the option, to cite any number of reasons why they would not accept a voucher that a student with a disability might hold. And so I'm just wondering, has the council ever looked at that, had discussions with the legislators about that aspect of moving these public dollars to private?
Hi, Kay. Yes, that is something that the council was very concerned about last year when it came up, and it is something that we would oppose, I think, again this year, after we look at what they put together. So yes, we are definitely looking at that, and it is something that we're worried about. And
what do they say when you talk to them about it? What's been their response?
And this has been Bill, who's no longer with us, so I'm speaking for him. They listen to our concerns. I mean, I feel that when we do talk to them about our concerns, I feel that they do listen. Whether or not that's effective, I don't know. But I feel that they do listen to what the council is at least saying.
Kay, this is Carlin, and in some conversations I had last year, some of the response was that I think it depends on the area, but students with disabilities can still be served by their public school, even if they have the choice or make the choice to go to a private school. So I think the quick answer is that we hear is that they still will be followed by the public school and be able to receive those services. So, I think that's
albeit with less money. And that's a whole thing not said to them.
Mm-hmm.
Well, I do think that at least the Senate plans to continue to have virtual subcommittees. So you have the option of either going in person or providing testimony virtually. So at least in the Senate, there will be an opportunity for the public to speak and ask questions like those. So hopefully individuals that have children in the system that are interested in wondering about this will speak out. In the House, you have to be in person, but they have an opportunity. There's a place where you can submit written comments, which I do know legislators get a printout of those before they go into the subcommittee meeting. So they do pay attention to those. So I think we will make sure that we let people know during session when those opportunities arise. There may not be a lot of lead time, but at least have that opportunity that they can publicly share their comments, because those written comments are public. So that's a good reminder for us. Is there other questions? I'm kind of opening it up because the only thing left I have on my slides is to show you our new website and some dates, which I can do. I'll do that now and then. Go ahead. Oh, sorry.
I'm sorry, this is Deb. I was gonna just follow up on that. Are private schools, institutions, are they required to be wheelchair accessible throughout their buildings?
I don't know the answer to that. Do you, Brooke? Or is there somebody from DRI on that might know that? I don't know. We can follow up and ask.
Yeah, yep, we sure can.
I'm just very concerned about this same issue. My daughter is an adult now, but it doesn't make much sense to me to have that argument that the public school can follow the student if the public school is getting less money, and if the school, private school can reject someone because of a disability. Thank you.
Thanks, Deb. That actually reminded me of an adjacent issue. Last year, there were some family members that were concerned that the AEAs were not equitably throughout the state offering the same type of special education access to private school students. I know there was an issue up in Northeast Iowa. Most of these parents have sued and all of them are winning those lawsuits. And so there was some legislation that then Representative Sandy Salmon had advanced. And I think now that she's a senator, I would guess she's still interested in this. There was a small group that was supposed to be looking into this at the Department of Education, but they didn't really publicize their meetings. So Brooke and I both missed it. We will, I need to follow up on that too, because that kind of had some, not the same, but it was an adjacent issue with access to those in existing private school students. So I will do that. I think there's a question in the chat. Oh, okay. There is somebody with DRI. Danielle's on with DRI, so she'll access. Danielle, I'll follow back up with you on that. Thank you for doing that. Oh, Representative Ingalls mentioned that the bill I was talking about actually started in the Senate. Oops. See, I forget everything after session ends. I just throw it out of my brain. Apologies for that. I know I worked with Senator Kelker on it, and so that must have been why. Any other questions? I will think about them and throw up your hand if you want to. I'm just going to just briefly share my screen again with I'm going to skip back to, I just wanted to, oops, now I went way ahead. Wanted to go back to our website. I think a lot of you have seen the announcement that we merged all three of our websites that the DD Council hosted. We had previously had one for the DD Council, one for InfoNet, which is a publication of the DD Council, and one for Iowans with Disabilities in Action, which is the DD Council's network of advocates. And depending on what you were looking for, it might be on one or all of the sites. So to make it easier for everyone, we're all on one consolidated DD Council site platform. So if you go to iowaddcouncil.org, you will be able to find all of the resources. And if you're accustomed to seeing InfoNet, if you just go to the InfoNet tab and click on it, you will get everything that was on, and it'll look very familiar on that site. So I encourage you to take a look at all of what's there. Under events, there will be, again, the calendar for for the public forums. So there's usually 300 to 400 public forums hosted during the 4 months of session that legislators go to. So we keep a list of all of those there. So you can find out where those local opportunities on usually Fridays and Saturdays to meet with your legislators back home. You can sign up for these Capitol chats on that site. There's under events that the Capitol chats will also be listed. So you'll find all that kind of information. If at any time you can't find something, just shoot Brooke, Carlin, or I an email, and we would be happy to help you find that. And I wanted to give you a few updates before if you thought of some questions before. Session begins January 9th. I keep thinking that's a long ways away, and then I realize we're in December and start to sweat a little bit, but it's starting up January 9th on Monday. The governor will announce her priorities, her budgets, all of that on January 10th during her condition of the state speech. It's usually at 10 a.m. And public television usually carries that, so you can watch that. Or you can see it online on any of the, your news channels will probably have it. Our next published InfoNet will come out in January on the 17th, and we have the date for our next Capitol chat, which is January 27th. So we're going to continue to do these sort of last Friday meetings until we hit a holiday in May, and then we'll adapt it then. And then you'll start getting our Monday morning email, which is this kind of a recap of what happened at the Capitol that previous week, and a Capitol snapshot. So Carlin and I will be unveiling our new video chat Capitol snapshots, where we kind of just go over what happened that week for those that like to see things in a video format versus reading them on a email. So I'm going to stop sharing. And
Kay has her hand up again, but I don't know if she has another question. Kay?
Not a question, but just wanted to make sure everyone's aware. The Health Policy Oversight Committee, it's supposed to have 2 meetings every year. They're actually meeting next Friday on December 9th. And the mornings, they're meeting twice, in the morning and the afternoon on that one day. The morning looks like it's mostly Liz Matney and the MCO, what's going on with managed care. And then in the afternoon, though, Kelly Garcia and Liz are going to talk about the Glenwood Resource Center and community integration. So, and both sessions have the opportunity for public comment. So
I think you have, I can't remember how they did it last year, but I think you have to be in person for public comment.
I think so.
But you can watch it online. So I think the public comment would only be available to people that are in the room. But you can also watch those. And if you go to the website, which I'll post in here, if you go to the legislative website, you'll see the announcement for the Health Policy Oversight Committee. And then you can, not doing very well typing and talking. If you go to the website, there's a calendar right there on the front site, and you can click on Health Policy Oversight and you'll get the agenda and how to sign up for a link to get on it. Or I think the link is right there too. The morning session, like she said, is Medicaid updates. And then the afternoon is more the Glenwood and the waiver review and all of that, and the community inclusion. That is how legislators meet the requirement to meet twice. They consider one meeting in the morning and one meeting in the afternoon. So that counts as their 2 meetings. So they will shut off the system over the lunch hour and then start back up. All right, any other questions? I see the comments about the cross disability Capitol days. Brooke and I can talk about that off in Carlin as feedback. Well, we are 2 minutes from our time, so I do want to thank our ASL interpreter, Amber. Thank you for being on and helping us out here today.
Everybody have a happy holiday.
Yes. Thank you, everybody. Thanks for joining us.
Bye, guys.
Buddy, happy holidays.